Recent jump in sexually transmitted diseases across the Baton Rouge area. A pair of outreach groups recently partnered in an effort to bring down the number.
News' Joe Collins has findings from recent studies on several kinds of infections.
Louisiana's infection rate for STDs has long been high, and among Louisiana cities, Baton Rouge has often been towards the top. Metro Health's Community Advisory Board, along with a group called Community Access Incorporated, are hopeful they can find a safe path forward.
To come up with a method to address some of these things and to develop some goals and objectives that will help others not only get educated, get tested, get treatment, or cured.
They asked the public several questions, including what they knew about STDs, how they felt about access to health care and availability of STD resources, and what kind of support is most needed.
We did recruiting for those interviews. We did focus groups at the O'Brien House, and the CAP members just basically asked those questions that CAI presented here on today. And we got feedback, we got the community involved, and what they thought about the rising rates here in in Baton Rouge.
According to data from the Louisiana Department of Health, Baton Rouge and surrounding parishes saw more than 2,200 new gonorrhea diagnoses in 2023 and over 6,300 for chlamydia.
In addition, which I find more alarming, is over 200 cases of syphilis, right? That's a concern because we had eradicated syphilis in this region for a long time.
Collins says the data for 2024 so far shows that new cases are trending upwards. Participants the board talked to included college students, teachers, seniors, and more. Education and outreach was something that they thought could help more, whether it was going to schools and starting earlier with education about STIs. Insurance, costs, and not enough people knowing where to go were some of the answers about access and availability of STD resources.
I read on about the STDs and HIV, stuff like that, because you can always learn more.
As for what's next for the organizations, it's taking that feedback and finding ways to implement it more now.
We're still working with Metro Health. We'll be back here next year to work and go deeper, see the responses that we're seeing now from these community members. They have prioritized what they think is important.
Joe Collins, WBRZ News 2.